Hi, my name is Susan Smith and I'm a nurse practitioner here at Roswell Pediatric Center. Recently we've been overwhelmed with calls on the H1N1. Now this is resulting in a longer response time on returning calls to our parents. But we do want to reassure you that your call is very important to us. We're making this video today to give you advice on the H1N1 on what you need to do as a parent. There is no doubt that the H1N1 is in our community, but we do want to let you know that we are working with schools and daycares to help keep the exposure down. Today, I'm going to give you advice on who needs to be seen by a practitioner and what you can do at home. Now, most children who develop the flu have a few miserable days at home, but nothing more. These days are spent best at home, not in the emergency room, pediatrician's office, and certainly not at school. But don't panic. Let's take the word H1N1 out of the equation and treat it like any other illness. Would you take them to the hospital for the regular seasonal flu? Probably not. We can test for the H1N1, but the test is only 70% accurate and does not influence our treatment decisions. Now let's decide who needs to be seen in our office. We want to see children that are aged 2 years and younger, or children with a chronic illness such as asthma, diabetes, or heart disease. We're looking for 3 symptoms or conditions that are present, such as a sudden onset of a temperature of 100.4 degrees or greater, and a sore throat and or cough. Now if your child has a fever of 100.4 degrees or greater, and a cough and or sore throat, is 2 years of age and younger, or has a chronic illness, then we want you to call and schedule an appointment. When you arrive, we will ask that you and your child wear a mask, and this is to protect the other patients in our office as well as our office staff. Please don't bring your child in unless they meet the criteria we've reviewed. You could be exposing them to the H1N1 or any other illnesses unnecessarily. No medications cure the H1N1. Antibiotics will not work. This is a virus, not a bacterial infection. In some special cases, the practitioner may prescribe an antiviral medication, such as the Tamiflu, which may help make the illness milder or shorten the duration by about a day or a day and a half. But please keep in mind, Tamiflu, as with any other medications, will have side effects, such as nausea, vomiting, hallucinations, or just make your child feel funny, and they don't like that. So, if your child does not need to be seen in our office, then there are some things that you can do at home. Fluids, rest, fever reducers, such as Tylenol, Motrin, or Advil, and we do have dosage charts available right here on our website under the Child Illness section. I suggest that you print those out and keep them in your medication cabinets for future reference. Saline nasal drops, nasal sprays, suctioning for infants, or help encourage those older children to blow their nose. The best prevention is good hand washing with soap and warm water. Now it's fun to teach young kids how to wash their hands and to do it for a long enough period of time to kill those germs. By teaching them to sing happy birthday 2 times will be a long enough time to help kill those germs. If soap and water are not available, alcohol-based hand sanitizers are acceptable. Avoid touching eyes, nose, and mouth. Avoid close contact with sick people. Teach kids to cough into their elbow, like this. Sneezing into tissues and throwing them immediately into the garbage. And help stay home from school, work, for at least 24 hours after the temperature over 100.4 degrees is gone, and that's without any fever reducers. But we do want to inform you that we have enrolled to be a provider of the H1N1 vaccine when it becomes available. We will follow the CDC guidelines for administering the vaccine. So please make sure your child is registered right here on our website so that you will receive the updates from our office with important information regarding the H1N1. Now, if we haven't answered your questions today, please feel free to call our office. Thank you.